Unplugged Stories by Dr. Samatha Tulla.
Well, good morning, Dr. Samatha, and an official warm welcome for Unplugged Stories and a brief introduction to the audience about Dr. Samatha. Though she will be talking quite a lot about what she do and about her practice. So the one keyword which I would like my audience to get registered is Dr. Samatha is directly proportional to longevity medicine. Okay. So with this, Dr. Samatha, the title of the Unplugged series is Longevity the New Buzz or the Ultimate Healthcare Luxury? Okay. And what I would like is that let's take a little bit deep dive into from beyond being from the conventional medicine, that unlocking the personalized health and the longevity. So with this, Dr. Samatha, my first question to you would be, what was that defining moment when you realized that personalized medicine was your calling? And how did it all started?
Thank you, Vishi. Thank you for your introduction. So what is my calling towards personalized medicine? Yeah, after conventional medicine, like all the postgraduates are very eager to come up with a diagnosis, come up with treatment solutions. I realized whatever treatment protocols that we went through as a part of conventional training were not working for everyone. So then I felt something is wrong. Either I'm not connecting the dots together or I'm not fulfilling something. So then I realized the power of lifestyle interventions, nutritional interventions, like how much we were not taught during conventional training, that these are so important, because that is going to define if the outcomes of a given individual while being on certain drug or a medicine is working for them or not. So that is where it hit me, that a personalization needs to be done for an individual depending on where the individual is coming from. Is the person already following certain nutritional lifestyle guidelines and yet been hit by disease, or the outcome of a disease is because of those unhealthy lifestyle choices that a person had? So that was a moment when I realized, okay, there should be something more to what we can do with a given problem statements of an individual.
So what stage it was? I know that you did graduate from Gandhi, then you went about doing your post-graduation, that too in oncology. It's totally a different shift towards preventive and the personalized medicine. Can you give a little bit more insight from that line?
Indian healthcare as such is very reactive oriented, right? We react to what people present with as health problems. So I was part of that reactive healthcare as well till 2016, during which time I realized that there should be more proactive approach, more preventative approach, because I understood there is only so much that we can do when a client is already in a stage 3 or stage 4 or has already developed some serious organ complications. Then I thought I can, me as an individual, as a doctor, Samatha, I can do a lot better when I work towards proactive preventative strategies. So that is another turning point for me. So that is when I realized the power of other methods of medicine, not just conventional, but also functional medicine, precision medicine, where there is more deep diving into finding the root cause of an individual, finding into circadian rhythms, finding about nutritional, not just nutritional deficiencies, but nutritional insufficiencies, also about hormonal balance. So these are certain areas that has inspired me to work more from basics, building the foundation up and then working at various levels to unlock that potential energy that all of us have. I did get certified in precision and anti-aging medicine, which purely focuses on systems biology approach, finding the root cause. By finding the root cause, we mean there are certain domains that we need to look into. Whatever the client is, whatever diagnosis a client has, we need to put it into buckets to see where they are falling. How is their detoxification system? Are they mindful? Are they following mindfulness? Are they exercising? If they're exercising, how is their non-exercise active thermogenesis? Like how is their movement throughout the day? How is their sleep cycle? Is there a sleep hygiene at all or not? And then is there inflammation? And how is the oxidative stress? How is the hormonal balance? How are the nutritional deficiencies? So we need to cover on all these aspects with whatever diagnosis that is there. A person could be a hypothyroid, a person could be a diabetic, a person could be having a metabolic syndrome or some kind of cholesterol disorder, and some issues with coronary artery disease. Whatever the diagnosis is, mostly we are trying to cover about autoimmune diseases and neurodegenerative and cardiovascular diseases. In all these diseases, we need to put them into these buckets and see. So this is called systems biology approach. This is what I learned while I was getting certified for this program.
So you did mention about precision medicine and longevity as your specialization. Yes. So in a very simple words, can you help us to understand what's the difference between the precision health or medicine or longevity medicine?
Yes, there are some core and common elements between both of them, which is it could be precision medicine or longevity medicine. When we are talking about precision medicine, it's like designing a personalized a protocol to an individual. So that precision can be in nutrition, that precision can be in giving evidence-based supplements, that precision can be in, for example, do this kind of exercise for these many minutes to unlock these benefits. So anything that an individual is given a personalized prescription in very precise manner in terms of nutraceuticals, lifestyle or exercise, it is called precision medicine. Now coming to longevity medicine. Longevity medicine purely focuses on age-related diseases. Mm-hmm. These age-related diseases are put into 4 buckets: neurodegenerative, cardiovascular, metabolic, and cancers. Mm-hmm. These are the 4 buckets of diseases that come along with us as gifts as we age. Now, whatever aging research is going on, that is what longevity medicine focuses on, to reduce the burden of age-related diseases in individuals. By that, what we mean is we are reducing financial burden, we are reducing reactive healthcare burden, we are improving individuals' optimal health, we are reducing the dependence of an individual as they are growing older. So what we are trying to do in longevity medicine is to reduce the risk of these age-related diseases, by which we can also say reducing the rate at which you age, or you can use terms like reversing your biological age, reducing your biological age, but effect being improving your health span, improving the quality of the life that you live. That is reducing the burden of fractures, reducing the burden of dependence on individuals because of n number of complications in like terminal stage diseases. So in longevity medicine, focus is on slowing down aging processes, or there are some pathways or hallmarks of aging basically to slow them down, ultimately to improve health span. This is what longevity medicine focuses on. So whatever it is, it could be longevity medicine, functional medicine or precision medicine, all of them have got some core and baseline foundational elements to it. Like fix the nutrition, fix sleep, fix the movement, exercise and manage stress. Unless we do any of these 5, we can't talk about any other layers to it. So it all focuses on optimizing these 5 pillars of health, which are very foundational, and then build upon it.
Okay. So what I understand is you go about fixing the core health part in the precision medicine, and further the person gets graduated for the longevity part.
Yes. So by that I mean there are various levels to longevity. By that I also mean longevity is accessible to everybody, but it depends on different layers. Like for a software professional, for him or her, fixing the circadian rhythm in itself is a longevity hack. For an entrepreneur or a CEO, fixing his energy levels and for him unlocking his productivity is in itself a longevity hack. For a farmer, for him, able to sleep well towards night without much aches and pains is a longevity hack for them. And
how about you then?
For me, I think I'm at level 3. Maybe I worked on a lot of these core elements already. And
you
trying
need to have your energy level high like a CEO.
Yes, energy level high. So want to sleep like a baby at night.
So what's
want
your
to unlock
sauce?
All those benefits.
So what's your secret sauce?
There is no secret. It's same thing what I preach. Get up morning, first thing in the morning. See the sunlight. Don't reach to your phone at There are a lot of things happening on the phone, on the WhatsApp, on your base camp, a lot of to-dos to do. But I don't reach my phone yet because I try to keep myself occupied. Not keep myself, my kids will keep me occupied because I need to cater to their things before they leave to school, things to pack or help them get to the bus. So these are certain things I do first thing in the morning, and having some very important sunshine on the face is very important for me. And these are crucial. Like that, it starts with day, ends with night, with a lot of these things which I'll eventually talk about.
So what I understand is you're a very simple person, and the simplicity is the your secret sauce.
Yes.
So I heard about waking up, kids, bus, sleep.
Yes.
Okay, good. So now let's go back to our next question. So what I have seen in PMX and with whatever the practice I know about it, you have been blending the cutting edge science with individualized personal care. So was there any personal experience that made you to rethink how the conventional medicine is working? Okay, man, how did you went about amalgamating the modern equipments and what all I get to see in PMX? So if you can give a little bit more insight, what exactly the PMX is all about and how this the cutting edge science, which the technology which you're using it, and if permit, I would request you can have a walkthrough of PMX center so that people are able to visualize it.
Yes.
So can you?
So what we're trying to do at PMX is, our focus is more on proactive, predictive, preventive, precision, personalized health. So
say that again.
Proactive, predictive, preventive, precision-based, personalized health.
All 5 P's.
All 5 P's.
Okay, I heard about
driven by a physician.
Okay.
So 5P medicine is what we follow. So what India currently practices mostly in hospitals is a medicine 2.0, where it's more reactive, because that is why ideally hospitals are there for.
Hospitalized.
Because we want to identify what the sickness is and treat the sick care. But what we're trying to do at PMX is to move little towards healthcare from sick care. I mean, we cater to sick people as well, but not so sick that they're in terminal stages. What we're trying to do is do a comprehensive health analysis, see where the individual falls. Are the basics right? Like, is the sleep okay? Is the nutrition fine? Are they exercising? Are there any deficiencies? Is there inflammation? Are they having mitochondrial dysfunction? Or how is their metabolic health? These are some of the basic things that we'll look into. There are different ways to look at it. We can look at blood biomarkers, we can do some imaging, we can do some physiological assessments, do some body measurements. So there are different ways to look at the comprehensive health analysis. Now, after doing such comprehensive health analysis, we need to identify what are the key problem areas. Is that particular individual didn't fix all those 5 basic pillars of health? Then we help them fix those pillars. No, he or she has already fixed those basic 5 pillars. Then we identify what is going wrong.
Okay.
Is their mitochondria not functioning well? Are they not digesting well? Is their gut health not supporting? Are they not eating good functional foods that should provide the vitamins or minerals that a person needs to thrive? So these are the different areas that we look into. Now coming to latest technologies. What are these latest technologies that we need in preventive healthcare today, apart from what is already available in a lot of diagnostic centers and a lot of hospitals, right? We have gone so much forward in healthcare that we now check blood pressure only on one arm and not on other arm. We need to be checking blood pressure on both arms. And we need to be checking pulse wave velocity and augmentation index to look at arterial health, which is being missed in preventive healthcare today. So these are very crucial. And since we're talking about longevity and aging, what are the key determinants to identify that a person could land up in certain problem so many years later? we need to look into VO2 max and grip strength. Grip strength to assess the muscular strength a person is having in today's time, which will define his or her health 30 years later, and also VO2 max. So basically, the more VO2 max, the better muscle health you have. It's like having better kitty amount so that you save it for later. And that will help you later when you have problem. So these are certain biomarkers extra that we look into to get to that precision preventive health.
Okay. And any other cutting edge technology that you have in PMX?
So now I said we look into such comprehensive assessments. Now, is there a way to look at all these biomarkers without human errors? So that is why we built tech around it. Tech and AI will enable preventive healthcare. Basically, to look into prevention, we need to be looking at far more biomarkers of far more blood tests. For humans can always make errors, and preventive healthcare looking into all these reports will take time. So we need to reduce time. We need to focus more on individual, not on entering the data or interpreting data. There we can leverage tech and AI. So that is how we are trying to leverage tech and AI to make sense of these biomarkers, interpret them faster, give them data-based actionable insights sooner to the individual.
Okay, that's interesting. So I keep hearing about multiomics.
Okay, so why are we talking about multiomics in today's time? So multiomics, is it for an individual looking to keep himself or herself healthy for longer duration of time? Or is it for individual who is in terminal stage, having to spend only 5 to 10 more years in life? So if you look at it both ways, multiomics is more for preventive healthcare. It's basically, if in today's time, a 30-year-old want to stay healthy for as long as possible, or he or she knows that they have a heavy disease burden in the family, that both their parents have n number of lifestyle diseases, and he or her do not want to fall into that trap of lifestyle diseases and want to take care, then how do we do it? Okay, there are n number of tests. Every test has got a value. Some tests can provide correlations, some tests can predict, some tests can tell what is going on in today's time. Multiomics, there is genomics, there is proteomics, there is metabolomics, there is transcriptomics, and there is lipidomics. Lipidomics change like every day, every month. So it looks into current health. Lipidomics can be done if you want to look into current health, like in this 1 or 2 months, how is the person doing like. Proteomics will change over a period of time. If the individual has made changes, then it would take at least 3 to 4 months to reflect in the test report. So proteomics will take time. Now coming to epigenetics. Epigenetics also will take time up to 3 to 6 months, depending on how much a person is changing in terms of their lifestyle interventions or nutraceutical interventions. Now these are all modifiable. These are all omics when made an intervention. When something is changed in the body, either via nutrition, either via supplement, either via medicine, all these biomarkers change in all these omics. But there is one omics which do not change despite whatever change you do within yourself, which is genomics. This is a one-time test but has some predictive value. Okay. If you asked me the same question 10 years ago, it did have some value, but we didn't know what to make out of the test. Are there any changes that I can make today and can change my genomics? It was not there 10 years ago. But today, though it is like a blueprint, though it says you have certain gene mutations, you're going to develop, you could be developing more of this disease in your siblings. It is like a loaded gun. But still we can decide if we want that to be triggered or not. So that is possible with epigenetics today. Because India is a diabetic capital, we all know that. But tell me genuinely, how many of them have got those gene mutations that they're suffering from type 2 diabetes? Most of them do not have gene mutations.
It's because of the environment
So
and the lifestyle.
there's lot to do with environment and lifestyle. So there is only so much genomics can determine. It's only 10 to 15% it can determine, but you can make rest of the changes in your lifestyle and environment today that can change the outcome. So that is the role of genomics today. But what are the other benefits that you can do with genomics? You know how you metabolize your caffeine. You know how you metabolize your nutrients. You know how your body is deficient in handling certain vitamins, so that you would know you may land up with certain nutrient deficiencies more often compared to other individuals. So we can look into nutrigenomics, which can help us make more precise decisions when it comes to evidence-based lifestyle interventions, nutraceuticals, or exercise protocols. These three can be made depending on how our genomics are.
Okay.
But again, if somebody has not done their genomic test at all and are still making these lifestyle changes, it is still okay. It will still reduce your burden of any disease.
One question which is very much always there in my mind, when we talk about genomics and the data through which we validate, and my understanding of 10 years back, it's almost of the data validation is through the Caucasian population, the white population. How much is it accurate for an Indian population? Or, I mean, does it really matter? Or does it matter or not matter? Because the data
It does matter.
Okay.
It does matter. Today, whether it be genomics, proteomics, or gut microbiomics, we need to look into Indian data.
So do we have such data through which?
So today, in last 10 years, we have been collecting data through multiple sources. Now we have multiple genomic companies who are doing Indian-based genomic studies. Yes, data is being collected in very recent time, but we need good amount of data to make predictive models on that, to make actions upon it. So it will take little time to understand how we can utilize this data to predict outcomes in today's individuals.
So the edge of PMX is that though the data is available, it's the art of you and your team. How do you go about interpreting and giving the right?
Yes, but let's talk about two kinds of data: big data, small data. You're talking about big data. Big data is at a population level. Look at the changes, what you're seeing in population level, and apply them to individuals.
Okay.
It is still a good thing to do, because if you have seen these many individuals in Indian population have so-and-so mutations, and you do this lifestyle intervention, it works for these individuals, it doesn't work for those individuals. It is a good thing to do. But let me tell you the importance of small data, which is taking individual. At PMX, suppose there are 100 clients. Take one client. For one client, when they landed up with us, their VO2 max was so-and-so. The grip strength was so-and-so. Blood biomarkers were like this. We made these lifestyle changes and given these nutraceuticals. See how a client responds after 3 months. What are the changes in those biomarkers? What worked for him? What didn't work for him? And make necessary changes and see after 3 months. So, doing an intervention, looking at the outcome, see how it changes for a given individual. That is the power of small data. That is what we are trying to do at PMX.
Perfect.
What works for an individual may not work for another individual, because it depends on a lot of modifiable factors, right? We know circadian rhythm is critical, crucial to correct a lot of things. But there are certain individuals very hesitant. You tell me, I'll do anything. I'll follow anything. I'll eat any type of food that you recommend. I'll take in any kind of nutraceuticals. But there are some individuals, no matter what, they're not ready to change their jobs, because that would define a lot of other important things for them, finances, etc. They're not ready to change the circadian rhythm. Suppose they're used to sleeping at 4 a.m. in the morning, waking up at 12 noon in the night. They still want to do that and still expect good results in their health. It is not possible. So, like this, there are very difficult, crucial elements though modifiable, client wouldn't modify due to n number of reasons, and still we have to work around it. So that is the power of small data or individualized data, or more personalization needed depending on the given individual, their lifestyle habits. So yeah, as much as big data is important, small data also is important.
Sure. So how do you go about capturing this small data? You use some kind of variables, or when you talk about your PMX being a tech and AI enabled, so you have a variable?
Yes, we do use variables like sleep tracker and CGM, which is a continuous glucose monitoring wherever required. We do not have to track data all the time. Suppose we made a new intervention, then we may have to track data. After the intervention is done, after looking at the outcome, then we don't want to track them for long. It's again, there are a lot of people who are data anxious. They look at the data and they'll be like, Dr. Samatha, what happened? My HRV crashed today after an intense workout. So as much as variables, day-to-day tracking could be useful in certain individuals only for certain period of time, it is not recommended all the time.
Okay. So Dr. Samatha, PMX Healthcare or PMX, it's not just one another healthcare company which has been rolled out. And when I was before this interview, I spent time going around your center. It looks to be quite futuristic, modern, and also in every touch point I'm getting to see there's a lot of evidence tracking is there. So can you tell us that what was the thought process behind PMX? And also I would be very happy, I'm very curious to know from you, what does PMX stands for? Okay. And what was the aha moment? Why does PMX came into existence?
Okay.
So that's would be my next question to you.
So PMX, the P stands for 5 Ps, which is proactive, precision, preventive, predictive, personalized healthcare, and physician driven as well. M stands for our model, which is measure, mentor, monitor model, where we don't just measure and leave you, we also mentor and monitor you. So that is the kind of experience that we wanted to give to individuals at PMX.
Say that again, mentor and monitor.
Measure, mentor, monitor is the model or the approach that we use to improve health outcomes.
Okay.
So by that we mean we just don't measure and leave you out. We mentor and monitor to see that you develop the health outcomes that a person is seeking for. So that is the kind of experience we want to give to individuals. So that is what PMX stands for.
That's what the X stands for.
Yes.
Okay, cool.
So the aha moment being, PMX, thank you for helping us unlock our health potential. That is the greatest aha moment that I can think of. Because I want PMX to act as a catalyst for individuals to unlock their health potential. That is what we want. And we want individuals to be more health literates. We want to improve longevity literacy or health literacy in individuals. We want them, while they take programs at PMX, to learn the things about why, what and how, not just for themselves, for their families as well, so that whatever they have learned during the program, they go and incorporate and inculcate into their daily habits and families, so that not just an individual lives healthier, but entire family gets healthier. So we want everybody to become health literates as well.
That's interesting. And so that's what I get to see. You are quite extensive into educating people and health literacy, so that the individual is accountable for his or her health, and they can take the very precise decision also.
Yes.
Okay. That's
and not just that, in all our models, clients play a very active role because it is more participatory medicine now. As I was saying, it was more reactive, where we go to a doctor and doctor writes a prescription and the client or a patient blindly follows it without any questions asked. But now it's more participatory medicine. The individual wants to know why a certain medication or a nutrient is given or prescribed. And in every ride, they have to know why, how, and what it does to their bodies. So it's more participatory. We have to go a few steps forward to understand their health. They have to come few steps towards us to give their feedback how the intervention is working out for them. So participation is at most very, very, very crucial, especially in personalized medicine, because we can't make it reactive for them. They have to understand the benefits. They have to understand the science behind why we are advising, and we would explain it in a way that they understand. I would definitely talk about the program Thrive. It is very well designed according to evidence-based protocols and practices. Via Thrive program, we do comprehensive health assessment for an individual in terms of blood, urine biomarkers, physiological biomarkers, which would include body measurements, and image-guided biomarkers, whether it could be ankle brachial index, spirometry to assess lung health, heart rate variability to assess stress resilience, pulse wave velocity and augmentation index to assess the arterial stiffness, ECG to look into heart rhythms, and other cardiovascular assessments, and also the DEXA scan to analyze body composition. It's not just about what your body weight is for your given height, but what are you made of? How is your body composition looking like? How is the muscle to fat ratio looking like? So, and these are very, very, very crucial. So after this comprehensive assessment, we give an actionable roadmap to an individual, what to be followed for the next 1 month, what to be followed for the next 3 months. Then we sit down together to write down what kind of outcomes we are expecting in the coming months, and take necessary actions towards it in terms of lifestyle changes, practices, evidence-based nutrition guidelines, any functional foods that a person has to incorporate to achieve certain benefits, whether to reduce inflammation, or whether to improve detoxification, or whether to correct the nutrition deficiencies. So we give evidence-based nutraceuticals along with lifestyle interventions for them to unlock their full potential, for them to reverse their metabolic condition, to improve their insulin sensitivity, to improve their gut health, and ultimately to reach their optimal health.
So, Dr. Samatha, to achieve this, when you say about participative health, you must be having a pretty good team.
Yes.
And there may be various stakeholders who come together to achieve this goal.
Yes.
So can you give us a little bit overview of who
just a doctor can't accomplish all of this, right? For a Thrive program to be successful, there are a lot of stakeholders. There are technicians who are doing these tests. There are nurses who are checking all these parameters. There are doctors who are giving clinical protocols. There are nutritionists who are working with them, and there's a health coach, and there is a psychologist who is working into addressing their behavioral issues. So, and there is a physiotherapist who is trying to align their balance, posture, flexibility, and strength. So, and also we're looking into cognitive health. So these are various areas that when we say comprehensive, it's not a bunch of blood tests and a bunch of urine tests. When we say comprehensive, we are looking into arterial health, lung health, cardiovascular health, cognitive health, and body fitness as well. So the stakeholders will include all of these people.
Okay. I remember when I was talking to 3 years back or 4 years back, you did mention about all these stakeholders having a uniform and equal weightage to achieve those, the full-fledged goal of the client of yours, right?
True.
So, and how is this entire process been automated in your company, or in what state you are in?
We give a longevity roadmap which is 60 to 70% automated, and rest of the 30-40% is us personalizing the report for an individual. And to give that personalization, we put people into different categories. Like, is this individual already having a disease? Is this individual not have a disease currently but is also not healthy? Or are they borderline in those biomarkers? Or is there another individual who is apparently healthy, no symptoms to complain of, but there's a family history of some metabolic disease in the family? So this could be another category. Or there could be another category where they want to do certain screening done because they're in their 30s or 40s and they know preventive health is crucial and they want to get regular tests done, but they don't know what to do. So like this, there are different set of individuals.
And you were supposed to take me through the journey of your client here.
Okay.
On the various the compartments, or I won't use the word compartment, it's not in a compartment.
Domains.
It's
maybe.
a seamless experience what I got in PMX. So can you help us like how the journey of your client looks like when they step into PMX?
Okay. So,
and especially with respect to your state of art, the equipments which are there and which I keep on eyeing on it.
Okay. So, if a person onboards onto a program, then blood samples can be picked up from their home itself. At home, so there are at-home tests. They can give samples at home. A phlebotomist will go home and collect the samples.
So currently your services only in Hyderabad or other cities?
No, throughout India.
Throughout India?
Yes.
Oh, wonderful.
So currently we have clients from Chennai, Bangalore, Hyderabad, and other states, other parts of Telangana and Andhra Pradesh.
Interesting.
Yeah. So collect the blood sample from the comfort of their home, then take a one-on-one intake call to understand their lifestyle, nutrition habits, social habits, and their medication history and the current health history. And they fill out a form for us for the dietary recall. And then we offer a health center visit for them, so that by the time they're at center, we have information about their lifestyle, their current health status, their nutrition status, and we also have the results of blood biomarkers that were collected.
True.
So we offer them center visit 3 to 4 days after the blood sample is picked up, and then at the center, we do other parts of investigations like DEXA, and to understand their risk into cardiovascular assessments and all of those, where the reports are generated immediately. And we give a personalized longevity roadmap to an individual based on their blood, urine, body imaging, cardiovascular, and other biomarkers that we have checked at the center, and give them the action plan. And then we support them through our user interface app, which is out to release soon in next 1 week to 10 days.
Okay. And Dr. Samatha, quite often you've been using this word called biomarkers. And for our audience, in a very layman language, which even our tataya can understand, what does biomarker? So can you help us?
Biomarker is any blood test that we use to understand functionality within the of an organ system. For example, high density lipoprotein is a biomarker. Low density lipoprotein is a biomarker. Creatinine is a biomarker. Ferritin is a biomarker. Vitamin B12 is a biomarker. D is a biomarker. All these are called biomarkers.
So can I say it's a litmus test for?
Yes.
Can I say in a very simple language, it's a litmus test?
Yes. Yes.
Sure. Well, thank you very much. And with this, we will move to a bit trending discussion.
Yes.
So I call it as breaking the barriers in healthcare and longevity. Dr. Samatha, if you look at it, longevity is the most fashionable word in this country. Okay, I would say world. I get to see in Singapore and US and Europe, and especially in our country, Bangalore, every day there's one conference. Okay, there's a lot of thought leaders who are coming and they are discussing. There's a collaborative approach to come towards and work towards a longevity. So my question to you is that isn't a longevity, what I understood from this is that longevity is not just in a trend. It's in a revolution which is going on, and it is very much evident.
Yes.
But the question comes is that, but is it for everyone? Okay. Or will it be the Rolls Royce of healthcare, which only the elite and the privileged class of the people can afford it?
I would say longevity is for everyone and should be for everyone. It could be a farmer, it could be a CEO, it could be a homemaker, or it could be a software engineer. It is for everyone. Let me tell you why. Because the foundations of longevity are free to do, and it's for everybody to do. It could be aligning with circadian rhythm. It could be to optimize the sleep. It could be to optimize nutrition. It is to knowing how to manage one's stress. It is knowing how to exercise and knowing about the movement, social connections, So longevity is not defined by a therapy. Longevity is not defined by a test, or longevity is not defined by that particular nutraceutical. So longevity boils down to having foundations right, like I was talking about: social connections, stress management, sleep, nutrition, lifestyle habits, aligning with circadian rhythm, and keeping body very optimized for energy, low in oxidative stress, low in inflammation, having a good hormonal balance, and very good mitochondrial function. These are the foundations of longevity. These are achievable with very basic things which are free to do. Yes, little bit investment is needed in terms of health, in terms of what kind of ingredients you buy so that you put in your body, and also what you put onto your body. We can make conscious choices as to what are those ingredients we shouldn't put on the body which can affect our health. Mm-hmm. So these are the basic choices one can make, and we don't have to afford a Rolls Royce to do all these things, right? Of course, a person who has Rolls Royce does some things beyond this. If somebody has already done all these adjustments, all the basic pillars are set good on all these areas, now is there anything else to do? Okay, where is your current health falling like? Are you good at everything? No current diseases? Mm-hmm. All your biomarkers are optimized? You're already following all these basic 5 pillars. You want to do more, you want to achieve more, you want more productivity in life, you want more energy. Yes, there are other ways to even get better, like cryotherapies, hot and cold therapies, and things like that, and even hyperbaric oxygen therapy. So it depends on at what stage of your health you're in, and it also depends on how much you can invest in. But there are earlier adopters, there are people who have Rolls Royce, who have hacked the basic pillars of health, who have already optimized their biomarkers already and want to improve more and more better. Yes, they can invest more, introduce more therapies, more cellular reprogramming, etc. So, but people are looking at very surface level from miles above and trying to see only these therapies and only these cutting edge technologies will give them longevity. No, we have to cover the basics first. What if you are doing other things and have no social connections? Because we have a lot of studies saying people are more depressed if they're living alone.
Got you.
So as simple as this, following foundational techniques, you need not be very affordable to do it, and these are free to do it.
So what I understand is, as we say in Hindi, achar, vichar, ahar, vihar, that's the foundation, and that is universal, and that is within us in our surrounding.
Yes.
And what I understood is that it's not the Rolls Royce. Rolls Royce comes next when your precision health has been taken care.
Yes.
When you set that standard wherein you are healthy in all your parameters.
Yes.
Then you have various other therapies, your IVs and your blue light or blue lay. What is that?
We have red light therapies, we have hyperbaric oxygen therapies, we have cryotherapy.
So they all are the things which comes and augment for us to better longevity.
Yes. These come into place when you want to do a lot of things and body would take a lot of time to recover, and you want to shorten recovery periods. There, to unlock certain potential, you can add on this as and when needed, and if you have got that potential in you. So it boils down to how much you want to get better, how much optimal health you need, how much you have in your bank account to invest on your health. So it depends on all these factors.
Bank account as well. Okay. So Dr. Samatha, this is one of my favorite questions, and I'm sure that audience would like to know more. Okay. Visionaries like Brian Johnson are pushing the boundaries of anti-aging. Do you think we are heading towards a future where the extended youth is a luxury, or can the longevity can become a global movement, or can it be equitable?
Longevity can be equitable and will become a global movement for all of us to be embraced. I would say so because there are a lot of things which are accessible and affordable that will allow us to embrace this longevity lifestyle. So it should be for everyone, I believe. Because there are about 1.4 billion individuals in India who are young and healthy today, are awaiting to be aging, and they're at risk for age-related diseases down the line. Imagine the burden of healthcare if this young population becomes such aged population with a lot of complications tomorrow. What if we can embrace that preventive lifestyle, embrace longevity lifestyle today, so that these young adults of India today will not become a burden for India tomorrow?
I like this statement. I believe if our health ministry or PM Modi Garu is listening to it, because that's going to be a very big health burden. And if we can incentivize the youth,
Yes.
and including people like us, to be healthy, then that's an interesting statement. So how can we achieve it?
I think incentivizing preventive healthcare strategies is crucial.
Okay.
We need to change the mindset of individuals. Today, people are more reactive in their approach towards healthcare, right? They wait for the problem to appear. But if we change their mindset, if we make them more aware of why healthcare being preventive is more important to them, because what they invest on themselves today, they will look at themselves as a better tomorrow. So you can see yourself being better in tomorrow's time, right? So if this mindset is changed, if we can incentivize this preventive testing and made more accessible, more affordable, and we can make this simple lifestyle changes very scalable, then we can solve the problem of aging population for India tomorrow.
So there should be our state government, central government, or the insurance company should come forward, or can it be that the entire business ecosystem?
There should be three things that should be coming together: innovation, including biotech, AI, healthcare. Second, investors. Third are policies. If all these three, and fourth being insurers. If four things can come together, if insurance is taken care for the elderly, because today's people will become elderly tomorrow. If they don't have the insurance and they're going to be dependable, then that is a problem. And if we are not going to incentivize individuals for doing preventive health checkups, they are not going to change their mindset. And three, we need innovation. We need scalable solutions. We need AI-assisted preventive healthcare strategies. And we need biotech and AI working closely for healthcare for doing all of this. So all these people as an ecosystem, if they can come together, we can solve the aging problem in India.
I came across one incident recently, a senior colleague of mine who turned 51, and without his health checkup or anything, his insurance rider become means he had to pay a double premium. Okay, and wherein I believe that insurance companies, if they're listening to it, they should look at incentivizing him, not doubling his premium charges. Maybe he's healthy. Probably he has never hit any emergency room, or probably okay. I believe that's the way how insurance companies can.
Insurance companies should focus. No, whatever insurance companies are there, they focus on terminal healthcare, they focus on reactive healthcare, right? So their focus should be shifting towards more preventive healthcare. They need to incorporate more multiomics testing, or for even simpler proactive, preventive, simple biomarker testing can be incorporated. So I think insurers should look at the way how this can be modified, not waiting for people to become terminally ill and fracture their leg to use the premium, but for them to use the premium if they do a preventive healthcare approach or use the preventive health checkups. I think insurers should look at it another way around. If they're waiting for people to fall ill, then we're waiting for a very big reactive healthcare burden that we are going to see in very future now in India.
Yeah. So what would be a 2-line statement for the policymakers from your end?
For policymakers, we need to come up with a longevity hub of Indian origin, just like how Japan and Singapore are doing, to solve the problem of aging, so that healthcare will be more proactive, not just reactive. It will reduce the burden of families, and also we can improve productivity of the individuals. And I think we can reduce the burden on both families on healthcare. So if we can come up with a hub like that, we can do a lot of studies to solve the problem of aging. We can work with innovators, we can work with insurers, we can come up with scalable lifestyle incorporating solutions, we can come up with scalable, affordable biomarker testing. Yeah, and we can incentivize this behavior as such of an individual.
So we should use a word called healthy aging.
Yes.
Okay, healthy
Yes.
aging part of it.
Yes.
So followed by that, I would like to ask you, in your experience, you've been practicing longevity medicine for last 5 years or maybe more
Yes.
than that. What is the biggest roadblock which is making the personalized longevity care accessible to everyone?
The biggest roadblocker for making personalized longevity care accessible to everyone is awareness.
Okay.
I think we need to democratize the longevity science to individuals, make knowledge more accessible for them. That is one of the reasons why we take knowledge sharing very seriously at PMX and try to make people health literates. So health literacy is very important. We need to make them more aware because science has got more open access now. We need to democratize longevity science as such to individuals and make them more aware, make them more we need to change their mindset as to they have to think more proactively than reactively.
So you've been using a word called health literacy, and there's a scary thing about the health literacy is in the world of WhatsApp university. They go about promoting anything from anyone. Okay, no validation. Okay, in that particular ecosystem wherein we have been flooded with any messages, how you take care or how you ensure that health literacy is being given by the right source or validated. Okay. And I believe that that's a very important thing which we all should work towards. Otherwise, like in our business, we call it as a smart content, simple, medically accurate, research-based content. Okay. So, so how do you take care of that? I mean, I'm just asking this question from a health literacy aspect. Because today everyone go and talk about from pudina chutney to, IV therapy.
So how do I go about when people ask short form?
No, you're qualified. You're qualified to say that. My question is not about you. I'm saying that's a big problem. How do a consumer can validate?
Yes, it's a very big problem for individuals because there's a lot of information for them to understand what is right and what is wrong. It's a big task, but hope I can make it easy. But there are a lot of people who are talking about health today. We can't go about validating every individual. I think they have to find their physician who is evidence-based and should follow rightful information. But that's a very big problem to solve for sure. Yeah. Maybe I'll come up with a better answer in the next podcast.
Sure, we can have a complete session on health literacy because that's something is what my mission is also. How to go about people being more accountable and responsible for taking the decision. That's what I believe the ultimate goal of a health literacy would be. Okay, sure. So now let's move to the next part, and this is something we call it as an unplugged moment of Dr. Samatha. Okay, so the first question to you would be that how do you unplug yourself from the digital world?
I use certain strategies. Whenever I reach out to phone very unconsciously, I'll be like, if I land up on some app, I'll be like, is this the app I want to see? Should I see it immediately? Am I going to solve some problem now? Is there somebody I need to text immediately? Then I'm like, oh no, I'm in the wrong place. I'm in the wrong app. This is not where I wanted to be. I opened my phone because I had to share some information with somebody, but I landed up in another app. Then I would come back. By these 3 questions, I would close my phone. Do I have to open this app right away? Is there something that is going to stop if I'm not going to be on the app for a certain time? Or is it the right app I'm on? So I ask myself these few questions so that I close it and I'm putting my phone back. That is one way. Another way, as soon as I reach home, I make sure I'm spending time with family and I don't want to keep looking at my gadgets because it will take away the connections between the families. I see people, they sit in the same room. Every individual is on their own mobile. We are losing connections like that. So I make sure I'm not on gadgets when I'm at home, unless it's very important that I have to inform something at work. But I would make sure I finish everything at work before I leave the workplace.
Any other recreation activity that you do?
Any other recreation? I like playing a lot of word games with my kids. We play a lot of puzzles together.
Mhm.
So that is our favorite game to play while winding down. We play puzzles,
And I
word
also
games.
feel that you don't miss any family function because most of the time, I guess that's the biggest recreation what you do it for
I think
yourself.
staying rooted to families is very, very, very crucial. Of course, when you have a very big family, it's overwhelming also to attend a lot of things, but not out of obligation. But it's nice to meet family members to just find out how they're doing, how their last month is looking like. It's nice to know, right? Like, yeah, it's nice to keep meeting your family more often.
Yeah, that's very important.
Yeah, not out of obligation, but to make real connections.
So, Dr. Samatha, are you a chai person or coffee person?
Coffee.
Okay. So, my question comes to you is that if you're given a chance, with whom would you like to have a chai? A celebrity with whom you would like to have a chai?
Not
It could
with
be an old celebrity or new celebrity.
not a celebrity. Maybe I'll have a chai either with Naval Ravikant.
Mm-hmm.
Yeah, that is one person I'm thinking about right now.
Okay.
Yeah, intellectually stimulating conversations may happen. Yeah,
Interesting.
yeah.
I thought, no. So we'll go to the next one. What are some books that you would recommend your viewers to read?
The three books that I would recommend is The Outlive by Dr. Peter Attia, by Naval Ravikant, The Alma Mater, and Why We Sleep by Matthew Walker.
That
I think
I read.
that is good one. And The Circadian Code as well. It's a good book. And recently I was reading Why We Die as well by Ramakrishnan. Yeah, these are few books.
Okay. So, do you watch televisions?
Maybe once a week. It has come down. My frequency of watching television has come down.
Okay. So, if in that case, what would be your, according to you, the binge-worthy web series recommended by you? Probably even the old one. Until you were busy recently.
Until I was busy recently, the binge-worthy it is. I wouldn't give away the crime thrillers. Wait. What was that one by Father? Father was the one. I know it takes away a lot of energy from us. That's the reason I stopped watching crime thrillers now. But I like thrillers as such. The Night Agent was one. Yeah.
So most of the doctors, they love crime thrillers. That's what in my recent interviews I saw that.
But now I choose to watch more comedy shows.
Okay.
Stand-up comedians now.
Whom do you like the most?
I watch a lot. I don't have a favorite yet.
Okay. Sure. So we'll move to. Can you share one of your most craziest thing you might have ever done? Or if not craziest, you can share your most adventurous thing.
Scuba diving.
Okay.
That is my most adventurous and most loving experience. And I want to do that again any day, up for it.
So do you have pictures to share?
Yes, I do. I'll share them with you.
So, Dr. Samatha, if your life had a background score, which song would it be?
I love this song very, very, very much. Urumulu Neemu Valai from Chandralekha.
Okay.
That song. Love it.
The Nagarjuna one.
Yes.
Okay. Thanks. So we'll go to the next question. Are you a street foodie or a fine dining person?
Fine dining.
Fine dining. And what's your preference? And what are those fine dining restaurants you recommend in Hyderabad?
I choose fine dining because I don't want to eat sugar, maida, and very processed foods on the streets. That is the only reason, not in terms of the environment or ambience. No, not at all. So by fine dining, I do not mean fine dining, but I mean choose to eat more anti-inflammatory foods, not very processed, minimally processed. I like seafood a lot, so any day.
Okay.
Yeah.
What habits keep you so grounded?
Habits. make time for family, meet them at least weekly once, speak to your children, play with them. I think have morning coffee with my husband. Yeah. Wind down again with my husband, telling the daytime stories, what happened at work.
So you want to tell today's podcast story to him?
Yes.
Okay.
I'm definitely going to discuss it with him.
If you could have a dinner with any historical figure, who would it be?
Historical figure. Ratan Tata.
Interesting. Okay. What's the best compliment you have ever received from your PMX client?
Dr. Samatha, thank you for helping me taking charge of my own health. I think that is the best compliment. Dr. Samatha, thank you. What would I do with all this energy now? Another good compliment. Yeah.
Who's your healthiest elderly client?
Healthiest.
What's the age? You don't have to disclose the name.
Of course, I can't disclose the name. 67-year-old. I mean, by healthy, I mean they have reversed a lot of things and they're doing good in optimal health now. A 67-year-old.
Who's your role model?
Who is my role model? Now I'm looking at Naval Ravikant wise intellect.
How about Milan Soman?
He is a role model for many. I admire him. Very inspiring. Yeah. I mean,
so you know that we have our healthcare summit coming up in Bangalore.
Yes.
How excited you would be if Mr. Milan Soman is also part of the session?
It would be fantastic. I love to sit on the same panel with him.
Okay, we are trying our best to get him.
Great.
Okay, so that it looks realistic.
Yes.
Sure. Thanks. To Samatha, 10 years down the line, where do you see PMX? And what kind of impact it's creating towards all the key points which you mentioned in last 40 minutes?
10 years down the line, I see PMX Health actively engaging in health policies at a national level to empower individuals to reduce the risk of aging burden in India.
Any numbers in mind? We are a population size of 1.4 billion.
I want this 1.4 billion young adults of India to slow down their aging process and to be in their best health and to become functionally very independent aging adults.
Well, this should become your mission statement now.
Yes.
Okay. So, if one message about health and longevity that you could put in the billboard across Jubilee Hills Crossroad, what it would be?
Your future self depends on today's choices. So if you want to see your future self at your best, then make rightful choices today.
So make rightful choices today. That's your single line statement.
Yes.
Sure. Thanks. So Dr. Samatha, it's been indeed a very insightful Unplugged Story session wherein you helped me out to understand the difference between precision health, precision medicine, longevity medicine. Okay. So we did discuss quite a lot about the various biomarkers. Okay. And I really congratulate you for where you stand and setting up the benchmark. As per my knowledge, it's one of the benchmark center in India. And so where can people know more about you? Okay, what are your Instagram handles? Or if you can share, that would be quite useful.
Yes.
So
I'll do share a website, Instagram handle.
So what are they?
I'm known as Dr. Samatha Tulla on Instagram. I have a YouTube channel by the name Dr. Samatha Tulla. We have our website, pmxhealth.com, to read various blogs. Yeah, these are various channels that one can look into.
A final word to wrap up this particular Unplugged story.
To unlock your best self, start today, start now.
Thank you. Thank you very much. So look forward to edit this particular session better and present to you all. Thank you very much.
Thank you. Thank you, Vishi.